Turning to your pulse on health on this Tuesday morning. We know it feels like fall outside. And when the weather changes, it's a good reminder that the flu season is upon us.
Yeah, so it's something we have to be on the lookout for, but this is going to help you stay healthy. Doctors are encouraging everyone to get vaccinated before the number of cases really starts to go up. So 12 News journalist Justin Pizzera, he's live outside of the Department of Health Services. And Justin, some doctors told you this is the best week to get those shots done.
Yeah, good morning, Allison. They say this is the week of Halloween, and this is the best week to get vaccinated because it takes a couple of weeks for these vaccines to really be effective. So as we head into this really time of year where we're going to see more COVID and flu cases, it's best to get that vaccine, let it get working, and then you can go on during the holiday season. Of course, a lot of folks are throwing parties. You're going to be indoors around a lot of people. The doctors say that typically in Arizona, we see respiratory illnesses go up in November and December. According to numbers from the state here, since the end of September, we've had 613 confirmed flu cases. There are a lot more COVID cases. In just the week of October the 13th, there were 1,400 cases reported. So I talked with a national medical director for One Medical who lives here in Arizona, and she says the good news is the severity of COVID isn't as bad, and the number of people who need to be hospitalized, that's not nearly as much as we saw a couple of years ago. She says one thing that she is seeing, though, especially with younger people, they're not concerned. They're very indifferent when it comes to getting vaccinated for COVID and the flu.
A lot of people were more enthusiastic to get the COVID vaccine in the past. And so I think what we're seeing is not necessarily COVID vaccine skepticism, it's more COVID vaccine apathy. So a lot of folks who are, young and healthy, they're kind of thinking, I've had COVID, I had COVID recently, I don't really feel inclined to get the vaccine. But the promising thing that I'm seeing is people who are older, people who have multiple chronic conditions, who are immunocompromised, they're still getting vaccinated.
So Dr. Bouillon does believe it'll be a tough respiratory illness season for us because right now the dominant strain of COVID in the UK spreads pretty easy, but again, it is not as severe. Now, as for the vaccines, right now the flu and COVID shots, they are separate, but you can get both at the same time. She also says it's important that if you are sick, to get tested so they know what they're dealing with because the treatments are different for COVID and the flu. And one of the interesting things that the doctor did point out that it is possible for you to get the flu and COVID at the same time. And they've even had some cases where a person has had different strains of COVID at the same time. We're live in downtown Phoenix this morning. Justin Pizzera, 12 News Today in AZ.